Hey, I'm going to give you an analogy that's going to make perfect sense to you as a parent, especially you parents who have children that are struggling through life right now. Whether it's your newborn baby, your 2-year-old toddler, adolescents, teen, even adult children that have had this struggle throughout their life. I want you to, this is going to make sense, okay? And the analogy of that is a storm. And you know, when you see the dark clouds up ahead, I know that when I don't see dew on the grass in the summertime in the morning, I know that there's something that's going to happen. When the dogs start to get a little funky and restless, sailors, red sky in the morning, sailor take warning kind of thing. You know, hey, when you feel like the barometric pressure is dropping, you people that know they had surgery or broken a leg, the joints start to ache a little bit, you know a storm is brewing. And the worst of those conditions, you know that there's something that's coming. And those are all indicators of what they call like a perfect storm, like a tornado or a hurricane that just wreaks havoc on, houses or woodlots or anything else. And we have to run through our lives, right? We have to take shelter. And so the same thing can happen to your child. We know that if conception was a problem, that's a little nick. We know if pregnancy was especially stressful, mom's working 60 hours a week, making deadlines, going home and putting another 60 hours in for the course of 3 days, working, trying to manage other children at home and running the house. That's stressful for a baby, and it sets the nervous system up for a stressful environment, because that kid, what that mom goes through is what the child in the womb is going through too. Then you have a stressful or traumatic birth, whether it be a C-section birth where they're pulling it by the head is usually what happens, or they're pulling baby by the head. By the way, watch my other video on birth trauma, then you'll understand this a lot more too. And then we start to, the baby that's not nursing correctly or not bonding correctly, or the adolescent child who is not really bonding, and now they're not making social contacts, and then that translates into the teen who's depressed, suffering with ADHD, depression, low energy, and that transpires into an adult. So the research is clear on this. Issues from birth and pregnancy can transpire throughout the child's life. And so what are we going to do to course correct that? And that's what I'm going to talk about. And that's how the perfect storm develops in a child, because it's an accumulation, and some more severe than the others, of a host of things that set your child's life up from the beginning and when they're born, and even the conceiving throughout birth, to happen out through the rest of their life as too. So how can you tell this as well? So easy test that I do, and first of all, we're going to talk to you moms first, because you moms get this. You moms understand that at 6 months that something's not right, but you were told to wait and see. Wait until a year, see what happens. That's common. Common isn't normal. Common is not normal. 2 years pass, they're not making some eye contact. They're just not quite coordinated. They're falling down all the time. Well, let's wait and see. Let's do some therapy. Let's see how that goes. 3 years, 4 years, now they're diagnosed with autism. And the moms, sometimes there's a tremendous amount of what they call mom guilt. Because you know what? I should have listened to my gut, and I didn't listen to my gut, and I started listening to other things instead. And I knew that I should have done something. I just didn't have the answers, or I didn't know the questions to ask. That's where I want to clarify this. That's where I want to give you hope, moms, into this video, especially today, because I want you to look at these indicators and say, there can be something that's done other than medication. There are other options. And I wanted this to make total, absolute, bloody sense to you as to why I'm talking about this. So what are some things that we start to see that show up, especially with birth trauma, or how this perfect storm starts to develop in a child? Well, first of all, colic. Colic, constipation, fussy, not sleeping, low tone is definitely an indication of a start to a life that's going to be full of struggles, okay? They're not bonding. They're muscle tense. They're really, really tense, or they're just like a floppy baby. They're just like, your baby just can't sit up. If they're not sitting like at 6 months or 7 months, that's when they should be crawling. They should be sitting up like at 4 months, right? On their own, and 5 months and 6 months. those are some stages that, hey, tells me baby's not coordinated really well and don't really know where their body is positioned, okay? The MD is going to say, wait and see, let's see what happens. What's this as well? So those are some things that we start to see as what's going to happen is the delayed milestones start to happen. They're going to course correct throughout a child's life. They're not making eye contact at 2 years of age. They're having constant meltdowns. They're having a hard time verbalizing, communicating. Just something is not right, and you sense it, you note it in the body. So what are we to do this later on in life? So that carries us through like babies, adults, adolescents, anxiety, not coming out of the room, just full of just fighting and struggles and not working and bonding and just all those types of issues that start to come into play. And usually they're waiting for a diagnosis with ADHD, neurodevelopmental delays, sensory processing disorders, and it could have been course corrected from the very beginning. So how do we course correct? Well, the option is wait and see what happens. And a lot of moms don't like that option. A lot of parents do not like that option because I want to be proactive. I want to be proactive in my child's health, and I do not want to live with regrets to wait and see. What we can do, starts here just in my notes, is activation. Mary talked about meditation, yoga in my last one. How do we stimulate that vagus nerve? Okay, remember, we have to start looking at calming the body down. So how do we calm the body down? How do we increase vagal nerve tone? That's another way. Watch my other video, meditation, yoga, relaxing, nursing, skin-in-skin contact, just to name a few. Food dyes, my gosh, food will light up a person that's having some issues with some neural compromise too. I see kids that have the Swedish fish. Oh my gosh, I see kids eat Swedish fish and they just go from pleasant to rose bush right away. They're like the opposite of, they go from carnation, nice and fuzzy and soft, to like rose bush full of prickly thorns. Like their demeanor changes. It affects them. So watch out for the dyes, the preservatives, the dairies in the food. Wheat causes inflammation in the gut. That will have an effect. Feed your kid full of omega-3s. Make sure they get fresh fiber at every meal. And definitely, probiotics will definitely help with this as well. Omega-3s, fish, you can get supplements for that too. As far as that. So feed their mental focus if they're old enough. Even 2-year-olds can calm down, relate to you. Okay, and then feed them full of good foods and take out the bad foods, the foods that are fresh fiber. Hey, let's face it, if you do not have to read what's in the ingredients, it's good for you, okay? You need to have like apples, give your children as much as it wants, as long as it's fruit and vegetables, and having these in your refrigerator all the time, cut up. It's easy for them to get access to. It's easy for you to give them. And when they're hungry, they just want some food right away. Okay, so get a hold of those too. Watch what you're giving them, watch the mental state. But what's happening to restore the nerve function? Because that's not going to restore the nerve function. It'll help, but it's not going to restore the nerves and how they're working. So we have to look at restoring the nerve function, and there's any interference to this nervous system is what we chiropractors call subluxations, meaning the nerve system is compromised, causing an increase of stress load to the nervous system. Okay, we need to restore movement to the spine. Upper cervical definitely stimulates this part of the brain. This part of the brain is called the prefrontal cortex. And when there's movement in the spine, it stimulates this brain to grow. When there's not movement, and particularly in this upper neck, this brain is not going to grow and develop the way it's programmed and designed to grow. And they live in the stressful mind, which is right back here in the limbic system and the amygdala, which they're living on a state of stress. They're seeing everything as stress. Everything's out to get them. We can't live like that. Stimulating the vagus nerve, restoring balance to that nervous system, whether it be through meditation. But chiropractic does a phenomenal job at this. It increases that vagal tone, not only to the heart, the gut, so it's not so compromised, so digestion becomes easier, but it also calms and relaxes so kids can respond rather than react to the events in life as well. Helps them meditate better. So with chiropractic care, we're actually looking at removing the old habits. Let's face it, stress will sticky. You know this firsthand. Job, that's just stressful. That tends to change your attitude, then it starts to change the physiology of your body, how your body works. Then it's going to start the physical body. Your head, your shoulders start to become crunched. You get that nervous stomach. All those start to happen. Well, a child is a lot more susceptible to stress than an adult. Okay, not only the physical stress, the chemical stress, and emotional stress, they're just way more susceptible because they're taking much more in from their environment, and they have no baseline for the experience. They're just saying, hey, this is a traumatic event, this is stressful, my nerves are wiring differently, I'm more susceptible, I'm more adaptable, but I'm also more susceptible to stress too. So I hope this makes sense to you, because one thing that you need to do is you need to understand, hey, some of the things that we call that are common are not normal. The wait and see approach is not suddenly good for the parents, okay? It doesn't. We don't want to have that regret. Do something before, because I can do a test in here, a simple test at 6 months, which is a head leg test, that can determine the tendency of developmental delays. And we can course correct that, so at 3 years old, 4 years, we can drastically reduce that possibility of that child having autism, ADHD, sensory processing disorder, having the meltdowns, having digestive issues, chronic illness throughout their life, because we did something much easier to correct when they're 6 months or 4 months or a day old than something waiting until the problem starts to manifest and snowball into a much bigger problem too, okay? So, hey, if this makes sense, I hope this does. I hope this is you get a better understanding of what the perfect storm and accumulation of these events from conception, pregnancy, birth is a big one, baby and infancy, toddler, the adolescence with the bullying and the teens, they start to accumulate over a period of time. And we want to set the stage up right for that child so they don't have to deal with this the rest of their life. Okay? I hope I can help you in any way possible. Help me help you by sharing this to people that you may know that are struggling with a child, that they just don't have the answers, or they're looking for a different way other than drugs or medication, or that's going to have enough long-lasting and maybe some side effects that we're just not really prepared about. Maybe a least invasive way. I'd have them give me a call, give my name. I'd be happy to talk to them one-on-one to answer their questions. I get questions like one time a week. Yesterday, had a woman call up and ask, hey, what is this about? I need to understand this. Let's talk to my husband. Do you have some resources that we can talk through and give us some options that we can know? She knows that I'm here as a resource, and I want to be that resource for you. Take care. Have a wonderful day. Get outside and play. Dr. Randy Wirtz in Thrive Chiropractic. Bye-bye.